everyone. My name is Jay Otto. I'm with the Center for Health and Safety Culture, and we're having a webinar today on what is guide service. And I'm joined by Karen G., who's behind the scenes, pulling all the levers and making everything happen, and Katie Dively, who's also going to be presenting. You want to say hi, Katie?
Hey everyone. As Jay mentioned, I'm Katie Dively. I also work at the Center for Health and Safety Culture. I am a senior research scientist. In that role, I'm also a trainer and a guide. So what you're looking at today in terms of this webinar is sort of what I do and what Jay also does throughout our work here at the center. So Jay, why don't you introduce yourself a little bit?
Yeah, so I'm Jay Otto. I'm a researcher at the center. I'm also the co-director. I've been with the center for coming up, I think, on about 15 years or so, and love the work, love working in different areas that we'll talk about, and I'm very excited to chat about this idea called guide service. So just a little bit, I think folks have gotten more used to virtual technology over the past several years. So you can use your chat box. You can find that at any time during the presentation. Feel free to put a question or a comment in that. Katie and I can both see that, and we might try to address your question or comment in the moment, or we may delay because we know the content that's coming up and may address it then. And we also have time at the end to talk to things. If you have any challenges with connection with audio or anything like that, you can click on those three dots and get some options. We haven't been having trouble with that, but in the past, we used to have some trouble sometimes with audio issues, but it's gotten a lot better. So a little bit of what we're going to talk about today, we're going to briefly talk about just the center to create some context where this is coming from. And then Katie's going to give us a brief overview of the positive culture framework, which is the context or the area that we do the guide work. And then we're going to go through and sort of talk about what is guide service. And we're going to look at that by addressing some common questions that come up about guide service. And then we'll have a time at the end to have open questions as well. So very briefly, at the center, we're an interdisciplinary group of researchers. And we really think it's important to do research, to learn, but we also think it's extremely important to bring that out to the people like yourselves doing the work. So we also engage in training. As Katie mentioned, she's the lead training person, and providing this guidance, this ongoing support, and all towards cultivating healthy and safe cultures. And our big picture work is to look at how shared values and beliefs impact the decisions that people make that affect their health and safety and the health and safety of others. Our work is extremely applied. All of our sponsors are folks, we have a few federal sponsors, we have several state sponsors, and then also community sponsors, but all those folks are trying to move the needle on very particular issues. So we do a lot of work in traffic safety. Traffic safety is a major public health issue. We historically have done a lot of work around the prevention and the misuse of substances, and we still do a lot of work in that space. And we do some work generally around aspects of violence, interpersonal violence, domestic violence, child maltreatment, child well-being, and different issues there. And often when we look at these from a public health lens, there are aspects of unintentional injury. And a lot of the work is around preventing unintentional injury by you all and some of the spaces where we're working. And we know that's a major issue. We know the pandemic also, really changed, I think, aspects of some of our data in terms of years of potential life lost and just fatalities. But still, unintentional injury is a major cause of years of potential life lost. And we know that these issues, while they may be handled differently in our communities, they overlap. We know that misuse of substances can contribute to traffic safety, and we know that adverse childhood experiences in terms of child maltreatment can be a contributing factor to misuse of substances. So all these things tie together as well. Our approach at the center, sort of how we do our work, is to think about research and research on how to grow positive culture and to improve health and safety, like with a specific end in mind. And that research includes like, how do we define culture? How do we measure that culture? And then how do we grow it? And then we think it's extremely important to build the capacity of a variety of leaders to apply this knowledge. And those leaders are folks like you, people doing the work. We consider you a leader in aspects of public health because you're the folks who are actually making the change and doing the work. So it's building the capacity of a wide variety of leaders. It could be federal leaders, could be state leaders, could be regional or community level. And it's just that broad range. And that is critical to achieving effective implementation, because we know we've got to have effective implementation if we're really going to improve health and safety. So this is sort of our big picture lens as to how we see our work and how some of the dots connect. But in particular, this aspect of building capacity is particularly challenging. There's no question that this involves transferring knowledge, right? Like learning. And we do that through training and webinars and sometimes writing articles and other things like that. But we also know that learning alone is not sufficient to really change outcomes. And that ultimately what needs to happen is that we've got to change practices, right? We got to change what folks are doing on the ground. That's where we're going to really see changes in the outcomes. And this is tricky because this work is complex. So while training, and we'll talk some about the training that we provide later on, is absolutely necessary, it's not sufficient, we found, because you leave the training with new knowledge, but in order to sort of do things differently, it's this follow-up. And that was really the nexus of how Guide Service came about. Guide Service started about 15 years ago. As we looked at and realized that training alone was not sufficient, we really needed to provide that additional guide support after training to really help folks embrace new ways of doing things and to try things and to build those skills. And that's a critical recognition, is that the work is about growing some new knowledge, some new understanding, some new ways of seeing things. And in particular for us, that's seeing things through a cultural lens. But it also involves a lot of skills. And growing skills is different than just growing knowledge. And we really recognize that it requires practice to grow skills. You can't go to a training and learn about how to become a better basketball player and be a better basketball player just having had the training, right? You've got to practice. And so it's that recognition that skills developed through the work of practice that really is the foundation of Guide Service, this ongoing engagement. It's interesting to see the sort of the call for some of this and new skills being needed as we think about broad areas like the idea of public health 3.0. If you have a public health background, you may or may not be familiar with this, but this was even prior to the pandemic, a call for a real shift in how folks were approaching public health and to think about their work as a health strategist. And that's a different way of thinking about public health and an individual's role in public health, right? To think about your role as a health strategist. This requires different kinds of skills, like strategic thinking skills. And it's takes a bit of work and practice and effort to grow these strategic thinking skills. But this is where we see, not just us, but sort of as a nation, the next steps in terms of aspects of public health. But we can also see this aspect in, for example, traffic safety as well, with the recent bipartisan infrastructure bill. It's called the BIL, or the bill. That's how transportation efforts are funded, right? It's in these massive bills that go on for many, many years. And MCHES has appropriated significant funds in there to really improve traffic safety, and in particular equity around traffic safety, because there are disparities in health outcomes for different populations when we think about traffic safety. And MCHES is having a real call to make efforts more impactful. And that's how are we evaluating the impact of countermeasures or strategies? How do we really embrace a safe system approach? How do we innovate to start to develop new countermeasures and strategies? And how do we actively collaborate with diverse stakeholders that we may not have worked with in the past? And all of these are skills. Yes, there's knowledge involved here, but there's real skill development that is required. And so when we think about our work, we really see a cultural approach as growing shared values and beliefs. That's how we think about culture to improve health and safety. And this is very complex work, and it too involves knowledge, but also a lot of skills. And what I want to do now is turn it over to Katie and have her walk us through some of the thinking about this as to how we approach this at the center to really create a context for where guide service comes about.
Great. Thanks, Jay. Well, I do want to describe a little bit about the positive culture framework that we use as a way to organize our efforts to improve health and safety. And just for a little bit of context, Jay said, like, this is sort of the context that we provide guide service in. When people attend a positive culture framework training, they're eligible to receive guide service. So I just did want to say that up front. And I think having a little bit of a review of the framework can help us understand just a little bit more about the service itself. So let's start by thinking about the difference between a framework and a program or strategy. And you'll hear that I'm calling these programs, but they can also be called strategies, or if you do work in the traffic safety arena, we can call them countermeasures. But a program, strategy, or countermeasure is a specific set of actions that we're engaged in to address a specific behavior. So for example, it might be a curricula that youth are engaged in to reduce underage drinking. Or it might be a specific policy that you're trying to have passed to increase seatbelt use. And maintaining fidelity to that program or that strategy is really important because we want to implement it in a way that it was designed so that we can be effective. So now shifting a little bit to be thinking about a framework, that is a little bit different. We view the framework as a way of organizing our work, like I mentioned. Our framework, as you'll see, has a process that we'll engage in. I'll describe that in a minute. We believe in growing key skills in 3 main areas that improves our outcomes. And we also sort of get that the quality in which we engage in the framework, or the quality in which we implement the process, engage in the process, and build our skills, absolutely impacts our outcomes. We tend to find that the higher quality of implementation, the greater effectiveness that we have. So this is the positive culture framework. It's, again, the framework that we use as a way to organize our work to improve health, to improve safety. You're going to see that it's really broad in nature, and it can be applied to a wide variety of contexts, whether it's working within an organization, working within a community or a state, and also can be applied to a wide variety of issues that you're working on. The left-hand side of this framework is a little bit more about the process that we'll engage in, where we'll do the work, which is across the social ecology, and also skills that help us be more effective. And I'll go over those at a high level in just a minute. The right-hand side of the framework, this green arrow, is really more about our goal and our outcomes. Let's focus there. Let's start on that right-hand side. As Covey says, we begin with the end in mind. And that's very true for us. And that's represented here in this green arrow, this upward pointing green arrow. This frames how we engage in the work. And we want to label our efforts very intentionally as those to improve health and safety. We're growing, we're improving health and safety. That's why we have this upward pointing arrow. It's working to grow or improve something. And it comes from this appreciative lens. As Ronald Fry would say, who studies appreciative inquiry, we move in the direction of what we study. And if we focus and we study improving health and safety, we might move in that direction. In the middle of the arrow, you're going to see kind of what we're doing to improve health and safety. We're focusing in on increasing protective behaviors, decreasing risk behaviors across the social ecology, which I'll describe in a minute. And how are we doing that? By growing cultural factors. And these are the shared values and beliefs that influence the behaviors that we're seeking to address. And we're going to want to prioritize these key cultural factors and put our attention there. And this is sort of where the core work of our strategies comes in, is working to grow or improve these cultural factors. So as we move to the left-hand side of that framework, we'll concentrate on a process for engaging in the work, core skills, again, that help us be more effective, and where we'll do that work. But let's start off with the process. So this is outlined in blue here around that inner circle. So first off, these steps are meant to be done somewhat in order. Once you've been doing them for some time, you'll start to see that you could be engaged in multiple steps at once. That's fine, but order is important, particularly when you're beginning the work. So the steps are intentionally arranged in a circle. You'll hear our team say often that we'll continue to engage in this process because we're never completely done improving health and safety. The issues might change, our populations might change, and there's always work to be done. And as you start to take a look or hear me describe these steps, you might start to see some alignment with other strategic planning processes. That's intentional. We've studied other planning processes as well, and they hold up well. The steps that we have here hold up well. We added a couple of steps in greater depth because we felt a couple of things were missing from other processes. So starting here, just at a high level, we're going to start with step 1. This is where we're intentionally engaging in planning and advocacy work. We're raising concern about the issue to increase engagement. We'll also want to raise hope to provide people that necessary path forward and that motivation forward. Perhaps here we're building the capacity of our stakeholders. We could be, I don't know, gathering stakeholders to create a work group or a coalition at the community level. We're going to be looking at available resources and creating a plan to secure some additional resources. We're developing timelines and an evaluation plan. As you're sort of starting to hear here, this is really establishing a foundation. This is the very beginning of our work and establishing a foundation from which all of the other steps will sort of rest. And the next step, step 2, we're going to be assessing the culture. We might be gathering existing data. We might want to be gathering our own data, but we're here to better understand those shared values, beliefs, and behaviors that exist. We'll also in this step want to be mapping out the strategies that we're currently engaged in to really get a better understanding of what we're doing to address the issue. This gives us that understanding, but it's also revealing maybe some gaps in our services or in our programs or strategies. We'll move then to step 3, which is to establish a common purpose. This is where we're making meaning of our data. We're prioritizing opportunities to really illustrate what's most important to begin with. This might involve some readiness issues, sort of what's most important to address now and who's most ready. But we're going to be leaving this step with a primary issue of focus. Another important aspect of step 3 is really developing a common frame. Ultimately, if you think back to the framework picture, this is determining what's in our green arrow. What are we working toward? What are we working to grow in terms of improving health or improving safety? And then in step 4, we're going to plan our portfolio of strategies, recognizing that we're going to need multiple strategies to be effective. Ultimately, there is no magic solution. There's no quick fix to any of the issues that we're addressing. We're going to need a mix of programs and strategies, and we call that our portfolio. In step 5, we're going to pilot test these strategies with a smaller subset of our population. We're going to want to learn how that strategy is being implemented, if any changes need to be happening before we take that into full deployment, which is step 6. So step 6 is implementation, where we're going into sort of that full scale implementation of our strategies. We're going to want to be sure that our team, our coalition, our work group is ready to listen to the conversations that our strategies are sparking or are creating and be prepared to guide those conversations. Any strategy that we engage in, any strategy, program, countermeasure is absolutely going to create conversation, and we want to put ourselves in a place to hear that conversation and guide that conversation. Step 7 is where we're going to evaluate our effectiveness and determine our needs before we re-enter that cycle again. We planned this evaluation in step 1, and we're sort of always thinking about evaluation and revising as we go throughout each step. Again, it's a process. We're going to continue to go through that process, and we can get better at it and sort of improve our work every time we engage in the process. The next thing I want to identify or walk through here are the skills that you see outlined outside in green, outside that circle. Leadership skills of the people engaged in the work have a really profound outcome in the work. Are we investing resources in building our prevention leaders? Are we building the capacity to lead across systems, to cultivate transformation? Leading work in this arena, improving health, improving safety, is not easy. And we'll really want to focus our attention to growing skills here, growing leadership skills. Communication is absolutely essential. We have to communicate in everything we do and in any strategy that we engage in. So we really need to build skills here, especially if we're trying to change beliefs in order to change behaviors. We want to really focus in on how are we communicating about the issue and be really intentional to be sure that we're not creating misperceptions and that we're doing so in a way that can really grow shared values, shared understanding. The third skill is integration. And this one is a little bit tough, but it's absolutely critical. This is where we're thinking about that portfolio of strategies that we're engaged in. We're looking at how we can align strategies to support one another. We want to look at these strategies to see if by any chance they're contradicting one another. This is a really important aspect of the work at the community level, especially sort of what is everyone doing to address this issue and how can we sort of leverage these for greater impact. And then last sort of on this framework is the context or where we'll do this work, which is across the social ecological model, across the social ecology within an organization or within a community. Now, this model might be familiar to you, and Jay, there you go, you can go to the next slide. Yuri Bronfenbrenner developed this model to really explain how kids learn, but it has really broad application in the work that we do in public health. It's essentially saying that individuals exist in a series of nested relationships within a series of nested social environments. We know that individuals learn from and are influenced by their families and their peers. And this group of family and peers influences what they believe and how they behave. And the same is true of schools that individuals belong to or organizations that we work for. We also learn from our community's norms, our community's laws, and how those laws are enforced. And now it's not just that we learn and absorb from these outer layers around us, but that we also can impact these layers too, right? We can absolutely have an impact on our family and our peers and on our organizations and on our community as well. But these nested social layers really influence one another. And knowing sort of how influential these layers of the social ecology are on individuals, whether that be ourselves, whether that be a member of our focused population or even a key stakeholder, we now know that we really should start to be thinking about placing strategies at each of these different levels. Having strategies at each of these different levels is what we would consider taking a cultural approach. Our goal would be to have strategies across these different levels, these different social environments that align and share and reinforce with one another. This is how we can sustain our efforts. This is how we can make that lasting change and ultimately transformation on the issue. This approach, sort of thinking across the social ecology, placing strategies across the social ecology, really transforms our thinking. In the past, we might have asked ourselves a question like, how do I get individuals to wear a seatbelt, right? Really individual focus frame. Now, by asking, what actions do I want to grow across the social ecology? Like what are the actions I want to grow across the social ecology to increase seatbelt use? When I ask it in that way, I've sort of fundamentally transformed the approach. We've broadened our approach. It forces us to stop looking for that sort of one strategy that's going to change that individual, because we know that there's no magic strategy, right, or solution to solve the issue. We're working on very complex social issues here, and there isn't one thing that we're going to find to address everything effectively. It's going to take these multiple strategies at these different environments to really embed health and safety throughout the culture. And again, just really a transformational way at looking at things, which is across the social ecology. So that was a really high level overview of the positive culture framework, but we did feel it gives us a little bit of a context before we start talking specifically about guide service. Jay, did you want to take it
Yeah.
from here?
Yeah. So just this idea, you can see, I mean, you can take this framework and we've used this framework with, for example, with communities who are working to reduce underage drinking in a high school, or much broader, you know, a state who is trying to work on impaired driving. But you can see there's a lot of elements to this, and there's a lot of opportunity to grow skills. There's skills at each one of these steps. There are lots of skills under leadership, communication, and integration. And this is where we really learned and realized that in order to do this well, it requires that sort of ongoing support. And that's really how guide service came about. So what we're going to do now is go through and describe and talk about guide service by addressing some frequently asked questions. And feel free to add more to the chat window. We'll keep an eye on those as well. But certainly to begin with, you know, what is guide service? So Katie, how would you answer that? What is guide service?
Well, it's something that we offer to individuals and to organizations that are, you know, those who are looking for just a little bit more support as they work to improve health and safety. And we support them in achieving their goals and creating that change. And I think that piece is important, is that it's not that like our team is coming in to say, here's exactly what you need to do. That's not it at all. We're working with them, you know, we're working together to create that change. And we know that change is actually really difficult, right? It's never easy, whether that be within a small organization or even a large community. Change is hard, it can be challenging. And guide service was really developed to help navigate some of that change process, some of those, I don't know, just that providing that additional support that's needed as folks engage in that work of improving health and safety. Jay, you and I provide guide service to groups in varying ways. And I think that that sort of brings us to the next question about sort of like, yeah, who is guide service for? And I think, I guess, as I start to think about who's it for, while there is no typical way of providing guide service, I will say that we do have a couple of things that I want to mention, that I do want to make clear. This service is working to build the capacity of one leader. It's meaning that it's not that a guide is working with your entire coalition or your entire organization or agency. It's that the guide is working with one selected individual, and that individual receives the support and then can relay it back to that organization or that community. And really, guide services is about growing that leader's skills and doing that. Um, you know, this person often, like as I think about the folks that we're guiding now, they can be somebody who's coordinating a grant. It could be a coalition or a work group leader. It could be somebody within an organization, like a project manager or something like that. But again, it's this one-on-one support with an individual, and then that they can support the change process and move their community or their organization towards their goals. And support is, you know, provided on a number of different things. And truth be told, it's for whatever is most needed by the client. Like, I would never say that I go in with an exact idea of what's needed for the client. I don't. It changes from month to month, from call to call. But I often work with groups to engage stakeholders. Like, I hear this question a lot, like, why is my coalition not engaged in this work? I hear that question on a regular basis. So often I find that we're working together to build a coalition or the capacity engagement of others around this individual. We often have individuals that ask for support in looking at their data and prioritizing their focus. Like, what should we focus in on now to address this issue? So we're often kind of supporting the work there, or even supporting the work of developing logic models or identifying the most appropriate strategies to engage in based on what their data is telling them. But I think the most important thing here is that it's really different based on who I'm working with. So the issue that they're working on, but also where they're at in the process. It's very individualized. That's another main point that I want to bring up. Like my guide calls, even if I have two communities that are working on the very same issue, my guide calls still look very different because their needs are very different. And then also, just in terms of the type of support that's provided, because of the large number of individuals and groups that our team has worked with over the years, we've gained a lot of tips, and we just love to share those ideas. I think Jay, you'd probably agree, we learn just as much from our clients as they learn from us, and it's a really cool opportunity to be able to share those perspectives and those lessons learned and those tips from one group or community to another that's facing a similar challenge. And then I guess speaking of challenges, we all face challenges in this work. The work of improving health or improving safety, whether it be at an organizational level, a community level, a state level, is really hard. And there are a lot of challenges that we face in that work, and we're really able to provide support to navigate challenges like this. We engage in this type of work every day. We research how to navigate adaptive challenges that arise in this work, and we work with you to really navigate those challenges. And then finally, here, what are those question marks? Well, really, it's that we provide support as it's needed. There's always a new question, a new challenge that's identified. And I think one of the luxuries that I feel about our team is that we really do work with a diverse group of individuals who are regularly offering their perspectives and their support to me and to the communities and organizations that we guide.
And I think it's also interesting, we can mention just the name guide service was very intentional because, you know, a lot of times you could think about this as, is this coaching or is this technical assistance? But we really looked at it as it's like a guide, because each community or project or individual working in their on their issue is going through a journey. And like Katie said, like all sorts of challenges come up. Things sometimes we might anticipate that, but some things we never thought, you know, would come up. It just, things come up. And thinking about the metaphor of going on a journey and a guide who's been on lots of other journeys, but has not been on this journey. So it is sort of having somebody go with you with a wealth of knowledge and experience from other journeys, but is going to navigate your journey as a unique experience, because it is. And that was really sort of the origin of the label as guide service, as a guide on a unique journey. And I think that does provide some insights about how we approach it.
Yeah,
So
that makes me think too. Jay and I were just sort of chatting this morning about when guide service started, like he mentioned, about 15 years ago. And I think about um, a community that was part of guide service 15 years ago is in fact still part of guide service today. But it's very different today. It absolutely is a journey. There's no question. As I think about what we were doing back in maybe 2009, in their effort to reduce youth substance use has absolutely evolved to something they're still doing those things, but it's also evolved and grown into many new areas and new focus audiences and additional substances. So it's just really cool to see the journey and to guide the journey that folks are on. So yeah, that just brought up that point for me. So what does it look like, right? Well, it looks like at least monthly phone calls, and this can be an actual phone call, or it could be a web meeting, right, where we are actually looking at one another through a virtual platform of some sort. But again, it's with one individual that's been identified. It can also be support through email or additional phone calls whenever necessary, but I at least want to have at least a monthly phone call. And these phone calls are sort of semi-structured, I'll say. I do keep an agenda. I often get asked, like, well, do you have an agenda for our calls? Yeah, I do keep a loose agenda because I do at the beginning of our guide service together, I ask questions because I want to understand the issue. I want to understand where you're at in addressing the issue. And then I sort of base my phone calls in terms of moving you to the next step. So I do have a loose agenda. However, we move at the pace of the client and we always seek to address whatever the most pressing issue is that they're facing at that time. My goal is to simply move forward towards their goals, right? To continue to sort of nudge along and move forward as they work towards their goals. Clients also, I think this is a cool fact that clients also have access to our staff through the guide. So again, our team has a wide variety of skills in different focus areas, just different skills that they come from their educational background or other work histories. And we also have affiliated faculty on MSU's campus that we can engage in when needed as well. Sort of at the end of, so they're year-long contracts. At the end of a year-long contract, we do create a summary report that outlines progress and success. It's sort of outlined according to the positive culture framework. So progress and success is sort of navigating that framework, as well as recommendations for next steps. Sort of a nice summary of our work together in the past year. As it relates to requirements or specifics of the service, um, well, like I said, you'd have to have gone through one of our trainings first. So again, the goal was of the service was really to support individuals after they leave a training and are looking for additional guidance as they work to achieve their goals. And so attendance at either a 2.5 day, which is our full positive culture framework training, or even just a 2 day positive culture framework training would be required. And also, as I mentioned, is that you're seeking to identify one individual to work with that guide. I said it is a 1 year contract that's signed at the beginning of our work together, and that also can be renewed every year. We sort of check in towards the end of that contract and see if there's any interest in renewing for another year. So, um, Jay, another question often comes up about like what kinds of groups do we typically guide? And now what I have just been describing to you was more about like when a community or an individual within an organization comes to us to sort of support their individual efforts to move towards goals at the community level or within an organization. But at other times, we do have a state agency or a large organization that comes to us and asks us to provide guidance to a group of individuals. Can you describe that a little bit more?
Yeah, so we definitely have circumstances where it may be guide work is a part of a larger project. So we've been engaged by, for example, by states who are doing a Partnerships for Success grant under, a SAMHSA funded partnership, PFS or Partnerships for Success grant. And then we're providing guide service to a wide variety of players. Community level could be community level prevention coordinators to help them move forward. So they're receiving individual guide service, like Katie said, working on supporting them in their context, but it's in a part of a bigger project where we may be also developing tools across the entire cohort of folks working on it. We've been engaged for several years with, for example, 9 communities in rural Utah working on increasing seatbelt use. So we created a whole bunch of resources and tools for them, and then providing individual support for those 9 public health educators working in those 9 different counties to increase seatbelt use. So it's individualized, but it also could be part of sort of a cohort that is funded through, a state or a federal grant working on a specific issue. So it can look like that. It can also look like Katie said, just an individual community wanting those services to work on their specific issue, which comes up as well. And then we also do some examples where we're doing more intensive work with an organizational leader. So that could be a state level leader, somebody who is overseeing, state funding or administrating federal funds to a wide variety. And we're really working at them thinking, how do we grow those skills for them as they're thinking about a cultural approach that's being undertaken that they're overseeing, maybe amongst others. So we're really thinking about growing some strategic thinking and decision-making skills amongst themselves, but also helping them set up systems where they're doing that with the folks that they're overseeing, really thinking about helping them, what's in your green arrow? What are the goals? Which can often be a very complex question to answer. It's not always straightforward. And even in situations where folks are reorganizing a program, or they're thinking about how might we do this differently, or how might we roll out a new strategy across the state. And so we could be doing some guide work as helping them navigate or relaunch or recreate a certain program. So that comes up as well. So Katie, what as we think about, what does a specific guide service meeting or call look like? And always that question, will I have homework?
One of the most popular questions. Well, guide, I think you probably get it based on what I've said, but each call looks just a little bit different, right? Because it's entirely based on what you'd like to address during that call. Logistically speaking, like to set up the next month's call on the current call. And at that time, we pretty much have an idea of what next month's call is going to be like based on our current discussion. So for example, if we're working through, like I mentioned earlier, like engaging stakeholders, we might discuss a variety of ways that a client could structure a coalition meeting, or we give tools on how to do that, or conversation starters to work with members. And then on the next month's call, I might check in to say, hey, like, tell me about how that worked. Did you try it? And if not, like, okay, like what might help us move forward to trying that on the next coalition meeting. Another situation might come up where a client would like support as they review their data and they're engage in a prioritization process. And I might offer suggestions of how to review the data, or we might do that in tandem with one another. I might offer a process for prioritizing data with the coalition. And so I might check in on that next month's call to see if that happened, or if they need further assistance before they actually engage in that next step of that prioritization process. And then to that homework conversation, no, there's usually not homework between calls, but I will definitely identify next steps to think about, to try before we talk again. And again, my goal is that forward movement, that you're moving at a pace that you have the capacity to move at, but to move towards your goal. So while there's not necessarily homework, I am going to nudge you forward. Now, things might be a little bit different in terms of homework in a cohort scenario like Jay was just describing, where we have multiple grantees funded by a state agency. In that case, we might have deadlines that we have to meet because of a particular project that we're working on. There could be tasks that we have to complete each month, but those are going to be outlined by their funder.
Right. And then how do you respond? Like, what if I don't know what we're focusing on, our issue? Like, I haven't gotten that far. How would you respond to that?
Yeah, I get that one a lot, specifically like right after a training. I get that question a lot, and that's okay. That's awesome. I actually kind of love that early conversation. Um, the way it often comes out, like the way I often hear this question is a community or an organization will come and they'll say like, there's something going on that needs their attention, but they can't quite determine what the cause is or what their focus should be. So it could be like a community coordinator that's coming to us because they're funded to address the misuse of substances by young people, but they don't quite know where to focus their efforts to be most effective. Like, should it be underage drinking, or should it be marijuana use? People are sure talking about vaping right now. Like, we can work together, or to try to figure that out. Or even like I'll have a community that comes to us that says, our grant says that we have to address XYZ, but all my stakeholders say that I actually need to address this. What do we do? That's always a fun one, right? But like we work through, again, like we do this a lot. So we sort of work through navigating some of those challenges together. Um, and again, I would say it's really just all about you here. Like, how can we provide support for you in the work that you do to move towards your goal? So again, that really individual focus here.
Right. I think,
Yes.
Yeah, go ahead.
Well, no, we were just going to see, like, we wanted to talk through some of the commonly asked questions about guide service just so that to start the conversation. But I do suspect that some of you may have your own questions about this service or kind of what could be offered. And so we just want to invite you to put in the chat window or even put in the Q&A box any questions that you might have here.
And you can also, if you have those questions that come up later on, feel free you can use this email address to mail those in as well. So
Yes.
whatever works
Thank
best
you
for
for
you.
that. And I think that's it. Sometimes folks don't know the questions until they leave and they're like, oh, there's the good one.
Yeah. So maybe talk a little bit about opportunities for getting some of that training, if that was something folks are interested in.
Yeah, so because it is a requirement of, you have to have had a positive culture framework training in order to receive the guide service, your next opportunity to become eligible for that will be a virtual training that we're hosting in September. So again, a virtual 3-day training. It is September 19th through the 21st. How we do this is we do two-hour sessions per day. So it's a total of 12 hours, but it's over 3 days, 4 hours in total over 3 days. We do keep these small. As you know, virtual learning is different than, in-person learning. So we do like to keep these quite small. We are limiting it to 30 attendees. They're very engaged. So there's a lot of interaction in this virtual training to try to get that full effect that we have in an in-person training. Small group conversation, polling, large group conversation, chat conversations, and so forth. But this is our full positive culture framework training. Because we do limit it to such a small number of attendees, registration fills up quickly. We have yet to announce this publicly. So if you are interested in the training, register soon. I am putting just a link. I hope it went through in the chat window, just so that you don't lose. If you want to just like take a look at that link when we're done here, that will tell you a little bit more about the training and opportunities to register. Okay. I think that's it about the training.
Yeah, and then just in terms of other services, so those trainings are available. Like we host what we call sort of like an open training where anybody can come and join in. But if you're in a situation where you have a group of people that you want to train all at once, we can also just schedule one for you. So for example, in June, I think I'm going the community in Massachusetts to do a 1-day training. Katie periodically goes out to communities. So that's also an option. And that can be, just scheduled at a time that works for you and works for us. And that can be a variety of different contents. We have a 2-day or a 2.5-day or 3-day positive culture framework training. We could also do a more focused training specifically around communication skills or social norms marketing, if you're doing that, around leadership skills or integration skills. So those are resources that are available. Again, our mission as a center is to bring this information out to communities. So you can reach out to us to explore that as well. We've been talking a lot about guide service, so that's something else we do. We also provide services just around assessments or surveys or evaluation. So if you're in a situation where you want to move forward on sort of a cultural-based approach or what you're thinking of in that arena, but you might need some assessments or surveys or evaluation around something, feel free to reach out. That's another thing that we can provide. And then we do periodically over the years, we've done a variety of webinars. So we just have those on our website that you can watch at any time or share with others. Some of them, they're typically about an hour, but some of them are shorter. So you can look at those resources as well. And then there's other materials on the website that you can engage with. And really, that's all the content that we had for today. You can reach out to us in a number of different ways. You can also sort of follow us on social media. But we do want to just pause again at this point to see if you have any questions or comments, just feel free to put them in the chat or the Q&A box, and we'll try to respond to those. But we really appreciate your time today. We really appreciate your efforts to work on improving health and safety. It is a very complex but extremely important issue and concern. And yeah, we really thank you for your time today.
Yes, thanks everyone. Appreciate your time today. We will record this and put it on our website. Greg just asked a question I want to address. Hey, Greg, nice to see you. What state of readiness or organization does guide service best serve? I don't know if Jay, you have an answer, but like any of them. Like
Yeah.
we sort of try to feel that out and just try to move forward. I think we've seen across all stages of readiness in our work.
Absolutely. I mean, we've engaged with communities that may be part of a cohort that are just getting started, and literally the person started their job, a week ago, and they're still figuring out where their office is and different things like that. To, as Katie mentioned, a community that we've been engaged with for close to 15 years, who is, and so it has a wide range. We really seek to meet, like Katie said, meet the client where they are and help them move forward. So it's really no best, but sort of when things are aligned to be able to take the next step forward. Yeah, and great to hear from you, Greg.
Well, thank you. Oh, so another question comes up. So this is a tough one. Tori, hey, nice to see you. Well, I don't actually see you, but nice to see your name again. Tori was in our most recent training. Communicating with supervisors. This is something that we do work on, right? So it's really that sort of step one planning and advocacy work. Sort of to establish that trust that, hey, I know what I'm doing here. Allow me to do that. Sort of Jay, how would you answer that question? Like, how would you start that conversation with a supervisor to say, hey, I've got the skills and I've got the capacity to do this work. Please trust me to do it.
Yeah, that's a good one. And I think it's that, I think an open, honest conversation to sort of bring forth some of the underlying assumptions that either party may have about sort of the ability to move forward, and sort of surface those. So it could be, exploring what might to your supervisor, what might your concerns be, and what might be some of the underlying assumptions that both of us have, but maybe we're not talking about as we move forward on this, or try to move forward on this. And can we surface those and sort of talk those through? And, what things could we put in place that might help you as a supervisor be more comfortable for us to take these next steps? And sometimes it's just challenging. We recognize that there are situations where the context isn't quite ready or right yet. And then it's that careful work of planting and nurturing seeds. So sometimes it's planning an idea and it doesn't happen as quickly as you'd like, but then it's just seeing when it can come up. And I mean, a good example, Greg, who made a response in the comments, we've been having conversations with Greg now for a couple of years, and just seeing when things could align with different funders and different sources and things like that. So don't be too discouraged if it doesn't happen on your timeline. That's frustrating, but don't give up. This is long-term work. So continue to plant the seeds, cultivate them, water them at the right pace, so that they can grow when the context is works.
Okay, those are all the questions that I see. Again, we appreciate your time with us today. We will record this and put it on our website. And again, our contact information is there. Should you have any questions, please do reach out.
Thank you so much
for the rest of your day.
Yeah, enjoy your day. Thanks so much for your time and for your work. Take care.